I'm here in Darlington with Nigel Perry, CEO of the Centre for Process Innovation, for the launch of the UK's National Biologics Manufacturing Centre. Nigel, why does the UK need the centre and what are its key goals?
I think there are a number of reasons why the UK needs this centre. They've been brought out in the conference today, which has been really very exciting. In essence, the UK has a fabulous intellectual supply chain of candidate molecules, candidate drugs. The purpose of this centre is to help those drugs get through manufacturing and scale up and out into the market much more quickly than they have been previously. To date, the only options that industry has for doing that is in America, and as we heard this morning, on the west coast of America and on the east coast of America. And our goal here is to give companies a choice and hopefully put the UK on that map so that we're the third world centre for the development of these drugs and these approaches.
Okay, today is the official launch, but work is already underway in the labs. I've already had a tour around and seen the people dressed in their white lab coats busy at work.
Yes.
Can you give us an understanding of the breadth of companies that will use this space and the level of interest that you've already had in the centre from commercial companies?
The level of interest we've had has been really very exciting, very interesting. We've got an industrial advisory board made up of companies like GSK, GE Healthcare, MedImmune, Fujifilm Biologics, etc., who have been guiding us and advising us on what this facility needs to do. So the level of interest in terms of specifications already very, very high. We've been extraordinarily successful in applying for projects through the collaborative R&D calls that are held in the UK, and our pipeline of collaborative projects is already in excess of over £4 million. And we haven't, as you've heard, as you've seen today, we've only just opened up the centre for the first time. So the level of interest from industry is extremely high. We now need to work with them and engage with them so that we can get across the breadth of things they want to do with us.
Okay, and what sorts of innovations do you expect will come out of this centre?
I think there's two sorts of innovations. The industry, again, as we've just heard this afternoon, is extraordinarily conservative. It's very reluctant to adopt and adapt new technology. So I think in sort of progressive, evolutionary type process manufacture, traditional chemical engineering, traditional biochemical engineering, we'll see incremental innovations coming through. As the industry gets more confident and is more capable of coping with the risk of the innovation, I'm very confident that we'll start moving into what I describe as revolutionary manufacturing processes, where we're able to deliver pharmaceuticals directly to patients at the point of need and at the time of need. That could be quite a few years away, 10 or so years away, I would guess, but the incremental evolutionary approach is something that we are starting work on now.